Can you hear me okay?
Yes.
Thank you to Shannon to giving up some of her time today and being here to talk about her experience with both the Elston Clinic and her surgery, and also to talk about how lipedema has been affecting her. So everyone, welcome Shannon. Thank you. So
Glad to be here.
yeah, the general structure of this is that we're going to talk a little bit about lipedema before you were diagnosed, how it kind of affected you, and then what you did to select us to have your surgery, as well as what it was like before the surgery, kind of during the procedure, and then how things have changed for you afterwards. So to get started, how did you discover that you had lipedema? Like, was there a certain aha kind of moment for you?
I've been dealing with it since I was probably 14 years old, and it got really it became a life-disturbing thing after I had my first baby. And it took from that time in 2013 until, oh my gosh, was it last year that I came up there? Was it 2022?
22,
yeah. It took that long. It took that long to get an accurate diagnosis, because when you're dealing with this, it's weird. It's painful and it makes you tired, and there's all sorts of symptoms that don't make sense. And so when you go to ask for a diagnosis or just ask what the heck's going on, you get told that all your hormones look fine and there's nothing wrong with you, and you need to work out more, you need to eat better. It's like, and when you're doing all of those things and continuing to, honestly, the best way I can say it is you get fatter for no reason, which is weird, and then start feeling awful and continue to feel awful. It's kind of a frustrating, to say the least, thing. And for me, I'm an academic person, so I dove into the literature and just happened to land on two things. I saw vein diseases, like different vein disorders, and then I found lipedema, and I started reading it and looking at the pictures. And it at first didn't really occur to me that that's what I had going on, because typically in the literature you see pictures of people with later stage lipedema, and also pretty commonly with obesity, which is not me. So I ended up going to a vein doctor, and they wanted to do surgery for like a vein surgery. And then I just didn't really believe that I had venous insufficiency. It didn't make sense to me. So I started diving in more, and I found you. And that's it. So I'm sorry, that's a really long-winded answer, but that's kind of it. I got, my own, I honestly think I self-diagnosed until I went to, I had two other consultations. You were my third one, and hands down, no questions asked who I was going to go to. I mean, I had my reservations about the other two surgeons, and I'm not saying anything negative. It just was not a good feel or fit. And so I came and saw you and asked if you could do it that day. And then I was in there, 2 weeks later, maybe?
That sounds about right.
That's the timeline. I mean, honestly, I've had, I guess, probably 3 times in my life when this has really flared up. The first one was when I was, when you start going through puberty when you're a teenager, and start, it's always associated with hormones. It makes that process harder. You start getting the trunky legs, and it's just weird. So that happens, and then you don't really think about it much. And then the second time was when I had my first baby. I was 33, and I gained 30 pounds in that pregnancy. And then after the baby was born, I didn't lose any weight. It just stayed the same. And then I just kept getting bigger, and my legs started hurting. And that was the second time. And then I think the kind of final straw was about 2020. And I went into perimenopause. I don't think it's early. I mean, in my opinion, it's early, but, starting of that was the third one. And it just got rapidly, progressively worse, rapid weight gain, a lot of, weird bruising. And I think I've said to you before, my legs literally felt like they were wrapped in cement, and I couldn't really function well. And I'm a really active person. So it was really strange. So always associated with a hormonal event for me. And I'm finding, I noticed, I guess, with age and with each subsequent time, it was worse. It was faster and more symptoms and much more disturbing to life, or life, I don't know what the terminology is there.
Right. And then, with the thing that's always been that stood out with your story so much for me, and it's really quite ironic, is that you were a bodybuilder for years and years, so you know how to train, you know how to exercise, and then you're also like getting your doctorate in like exercise physiology, correct? So I mean, it's like you understand like nutrition and physiology and like how things work. So for someone to not really be able to give you an accurate diagnosis and tell you, oh well, you just need to lose weight or you need to move more, it's like, no, I know how to do those things. Like I've been doing it. And I've seen the photos of you. You shared them before when you were in like your best shape when you were doing the competitions. And if you really look, you can still see like the early signs of lipedema on your lower legs.
And that's actually a really good point, because I think that's a pretty uncommon thing for people to do. Most people are not getting lean to the point where there's single digit body fat. I think my leanest time for bodybuilding or for figure, the competing I did was not single digit. I was probably like 11 or 12% body fat. But even so, when I was going through that process, you could still see there was still a layer that never would go away. And if you compare with other people, and that's what it is. It's a comparison sport, right?
Right.
Going through all of the same processes and doing all the same training, all the same dieting, I could never ever get all the way lean because I had lipedema fat on my legs.
And you talked a little bit about how lipedema has affected your life, particularly with pregnancy and then when you started to go into menopause. But could you be a little bit more specific about some of the things that you noticed that you either couldn't do as often or you were having a harder time keeping up with? I know you're very active and you hike and you've got a lot of dogs. Did you notice that the lipedema was starting to affect you in your daily life?
Yeah, my legs were just so heavy to the point where, I actually did a physical function eval just to, I needed to see where I was at. I was literally like losing physical function. Like I was losing the ability to, what are some examples? Like doing a step test, like stepping up and down, it was getting to the point where it wasn't endurance so much as I literally couldn't move because I had fat in the way. It was so weird. Or I don't even know if that's the right word. It's just, you start, your body expands, but as I understand it, lipedema fat, and I can certainly corroborate, you have these hardened nodules of fat and they're really painful, and that makes it harder to move. And so it didn't limit what I was doing. It just made it way harder. I did it anyway. I was still doing all the things I did. But when I got back, literally the day you saw it, the day I came out of your office, I felt like you took shackles off my legs. Yeah. So it's not that I couldn't do the things, it's just that I can actually do the things when I'm training. Like I'm out of shape and like, why is this not working now? It's like, I'm actually making great progress and I can do all these things. It just there was a pretty serious barriers.
Yeah, I remember the exhilaration and terror I felt at the same time when we finished your first surgery, and you stand up and you're like, oh my gosh, my legs feel so light, and you're stomping around like, wait, you can't do that right after surgery. You got to take it easy.
Well, that did happen, and yes, I'm not.
But you've also recovered very, very well from every surgery.
I did.
I think you barely took any pain medicine, which is not necessarily like typical, but you really bounced back really quickly and felt very good after every different stage of surgery that you went through.
That's 99% you for sure, and it is. The procedure itself was not nearly as difficult as I thought it would be, but also not having to go under anesthesia, that was probably the best part. There was no recovering from that part.
Right.
So being able to just go in, get it done, and then go through the process of recovering, like you said, and wearing the compression garments, doing all the things, it doesn't, at least for me, it doesn't take that long to bounce back. So pretty great.
And then with the compression garments, since you mentioned that's obviously a mainstay of treatment afterwards, and it's also something that typically you have to do beforehand as a requirement from insurance. What other kind of treatments did you do back before you had your surgery? What did you try and do conservatively to kind of treat this without doing surgery?
I always did compression and like compression therapy boots, like what's the pump that people get?
The lymphatic pump. Yeah.
I sorry, yeah, I'm like can't even talk. I didn't use a medical device. I used the one for athletes, and so I did that. I did manual lymph drainage. I did lymphatic massage. I did whole body vibration training. All of those things, which I think is really important. And I can say for sure that everything I've always done always helped with symptoms. It just never fixed it.
Right.
So I did all of those things for sure.
Yeah, and I think it's challenging
Still do
because
most of them actually.
they do help, but at the same time, it's like at some point you got to like get up and live your life. You can't just like stay like, live shackled to a vibration plate or a lymphatic pump all the time, because then you can't exercise and you can't like do the stuff that you need to do. So it is a pretty massive burden to patients to do all that stuff on the front end.
I definitely still do a lot of the things that I was doing before, not to the extent that I was pre-surgery, but the things that I had to do on a daily basis just to feel semi-normal was just not reasonable.
Right.
To be told that you're fine, there's nothing wrong with you, like to have to do all of those things just to be able to, get through a day and not be exhausted and hurting all the time. It didn't make sense. So yeah, there's a lot that you do, and I definitely don't need to do really any of that anymore. So that's pretty cool.
I'm going to transition now to talk a little bit about after the surgery, because I think we've talked about kind of like what you did before, and then you've talked a little bit about the recovery of the procedure. At what point, I know you noticed it right away, but at what point did you really start to feel like things were different, and you kind of got into this self-reinforcing loop of knowing that the surgery worked and you wanted to do other surgeries to kind of continue that?
I was up and moving immediately. I think probably, inside of a few days, and I've had several. I guess, I like in hindsight the way that you did it, the plan that you laid forth was, start at the bottom and work your way up and do this. And that's exactly what we did. So the more minor things like doing like my lower legs and even my, like the front, the upper part front, like that part, those were easy. Probably the hardest was, and it was exactly like what you said it would be. The 360 was just intense, and that was probably painful. And then you did my arms too, and that was by far the longest recovery. So to answer the question though, I think each subsequent one was a little bit longer of a recovery. So there was never a time when I could tell you, oh, it really worked, I need to do more. I thought immediately I want to keep going, because even though you're recovering from surgery, some of the things that I imagine other people deal with, like the easy bruising and just, I could just barely touch my legs and it felt like a hot knife. It was so painful. That went away immediately. So, but getting back to 100%, you can edit this. I'm the worst patient in the world. I am, and I know that. I am. But even being the worst patient in the world, I did what you said. I wore the compression garments for, was it whatever you told me. I think it was 2 months.
Yeah.
That part, it's not fun, and it's not fun being wrapped up and having to do that. But as far as like healing from surgery, the immediate effect, and then probably inside of a few days, was just, without question, I need to finish this off because it's working. When you're all the way out of compression and back to normal, it's almost like you don't really realize how bad you felt till you feel good again.
Right.
So.
Yeah, I try to explain to patients that the whole process can be like a little bit addictive. It's like it feels good to feel good, and like when you don't hurt anymore and you associate that not hurting with having surgery, it's like, I want to do this more. I want everything to feel better, and it kind of gets rid of that background noise that you're dealing with every day, that background pain that's just kind of like always there.
Well, and you spaced mine out what did we do, every 2 months? I honestly don't remember, but you laid out a very solid plan, and I just did whatever you told me to do, and it was a very good plan, and it worked. So it was get some of this done, recover, then do it again. And that was very good advice. The other immediate, and it's been a really awesome ongoing thing. And I think the way you described it was like, I had awful brain fog, and I always assumed it was hormonal, and it was, but you said, you're like, well, yeah, I took an entire endocrine organ off of you, and you're right, you did. It's like, I can actually think straight. I didn't have any association with those two. I didn't realize that's what was causing the problem, but I have no doubt now that it was, because it's gone. So that's pretty nice.
I certainly hear also from a lot of patients too that they can sleep better at night because they don't have restless legs, or that like the
Yeah.
shelf on their like upper buttock, that helps them to
Yeah.
kind of like not have back pain, and they can get in comfortable positions to sleep. And
100%.
getting
Yep.
a good night's rest can certainly help with brain fog as well.
I think it's just all of it. It really is.
Right.
It's a lot of things that I mean, the obvious things like your legs hurt and you're getting you're bruising and all the things that probably prompt most of us to go and ask for help. You notice that, but it's all of these other things that until they're gone, you don't realize that this is what it was associated with, or maybe even causing it. I have no idea, but
Right.
I'm certainly 100% better than I used to be.
That's awesome. And I get updates from you. It seems like every like 6 months or so you're out doing something fun, and it's usually centered around like you're really excited about the outfit that you're wearing. So
Yeah.
before the surgery, I mean, obviously there's a big functional component to it, but there's also a cosmetic component to it as well. I mean,
Yeah.
how has things changed for you afterwards in terms of like the clothing that you're able to wear comfortably, and how does that help with your confidence at all?
Well, yeah, I mean, it's a big bummer to, be like a really healthy, fit person, and then all of a sudden you're not. It
Right.
definitely does a number. I try really hard to stay focused on the reality of feeling good, and that really is my priority. But yeah, I mean, I can, with just coming to see you, I could come home and put on clothes that I bought 10 years ago, and it wasn't that they didn't fit because I was getting older and gaining weight. Is because I was expanding because I had lipedema. And so that was crazy. So yeah, I feel way better. It's a pretty bad feeling when when you try really hard to keep yourself fit and it doesn't look like it. I won't lie, that certainly was a big motivator for me to want to to get back to where I was. And so yeah, I certainly do feel better. I don't want to say I feel more confident. I don't want to say that at all, but I do feel way better. I'm happy I can wear my clothes again and things fit, and yeah.
Good. And you mentioned before that I wasn't the first surgeon that you'd consulted with. What was it about me or about the office that kind of tipped you over and you're like, okay, now it's time to like do this?
You listen. And that's a big deal. And I consulted with 2 other docs that have done lipedema surgeries, both very nice, both very good at what they do, I assume, but a lot of telling me what I want instead of me being able to say, this is what's going on, here's what I hope to achieve with this. They didn't listen. And I just, it's important to me to know that I'm being heard. And when I come out of this, if even, I can keep my expectations in check. I feel that I've always had really realistic expectations with this, and I have. But you never ever told me what I wanted. You just listened. That's a big deal. I think that's it especially sensitive thing for people who have gone through something like this for a long, long time and tried to get answers. And you get told so many times, that you're fat, which, yes, obviously that's part of why I'm here.
We were talking a little bit about the consultation process. You'd done a couple consultations and then you decided to go with us and felt like it was because we listened. But that kind of apprehension and hesitation is a pretty common theme with patients. So a lot of times it's because they haven't found the right doctor, or maybe they've been misdiagnosed. But a lot of times they're just very apprehensive about surgery. What would you say to those patients that are kind of on the fence, or they're trying to decide if surgery is right for them or not?
I think it's right to be apprehensive about surgery at all in general. And I think there's a point where if you've really done everything you possibly can to not have surgery and you still feel terrible, that it's worth deeper thought into whether or not you want to have surgery or feel better. And so there's that. But honestly, I think there's with this particular surgery, I can't say enough. Like the fact that I was awake the whole time, completely coherent and with it. I understand that's probably different for some people. It didn't bother me, but it's not a terrible experience. It's just not. I think it's good to talk to other people too. I really do. I've talked to a number of people that I believe even done surgery on now, that have had questions. And so to be able to get your questions answered and to know that the likelihood of something bad happening is very, very slim. And really all that's going to happen is you're going to feel a million times better afterwards. I don't want to speak with authority here, but I truly believe that if you have lipedema, there is no other way to get rid of it than to get rid of it. It's not, symptom relief is okay for a while, but once it's gone, it doesn't come back. Like I do have some other spots that we didn't treat that I probably will do, because all of the parts that you have treated, it hasn't come back. Mm-hmm. And so that's it. Do what you need to do to get to where you feel okay having surgery. That's my best answer.
I think I have this challenging conversation with patients a lot of times because they don't know when the right time to have surgery is. And I usually
There's
try.
There's never a right time.
Yeah, I mean, obviously I do better the sooner and more frequently people have surgery. So I try and let them know I have a little bit of a conflict of interest, but you know, it's like it's not going to get better on its own. It's only going to get worse. No, it's not.
There's never a good time.
Right.
It's like all things. There's never a good time. You just need to make it happen. And you know, the sooner you do it, the sooner you get your life back. I literally got my life back. That is not an understatement. You know, I don't want to minimize that people feel nervous about having surgery. I get that. I totally do. It would be weird if you didn't. Mm-hmm. It's anytime you have a medical procedure, it's always going to be. But you know what? I did the things you asked me to do. You know, I followed the directions, followed the pre and post-op for the most instructions. Yeah. But yeah, I mean, it's just not. It's not awful. It's really not.
Yeah, that's what most people say is once we get started, they have a lot of apprehension, and they're like, oh, this isn't anything near what I thought it was going to be. I'm like, well, geez, what do you think it was going to be? I can't believe you signed up for this.
I know. Well, I would have done anything, so I didn't have any apprehension. I really just wanted to feel better.
Yeah.
But to know that you're going into a surgery and you're going to be fully awake and alert, it's a little bit of a weird thought. And I think even to that, you know, if that's for a lot, I'm sure that I'm sure that would be a very different thing for a lot of people. I know that. Going in, you can see what's happening, you can hear what's happening, but you can take a sedative. I mean, there are ways to get through it without it being a traumatic thing for those that are worried about that piece.
Right, and then of course we offer, we can go to a surgery center, we can go to the hospital for some of the bigger cases, but 99% of what I do is here in the office.
Yeah,
and most people get through it really well. I think they think that. This was way easier than I thought it was going to be. And, I mean, I think there's something to be said about having agency over what's going on, that your doctor is actually doing your procedure and it's not like an assistant. You know exactly what's going on with you. You can see what's come out at the end. So you know that it wasn't like a sham surgery or something like that. It's really important for a lot of patients. And that's why I think we're doing so well that, because people know that they can trust us before, during, and after the surgery.
It speaks highly of you that, and I would hope that this would be a common, it should be the norm, not the exception. But the fact that you're more than happy and willing and in fact encouraging to do a completely awake surgery where you're alert, every single thing that's happening and you can watch, would certainly gave me some assurance that you believe in what you're doing.
Right.
So
yeah, it certainly it adds a layer of complexity for me, but for the most part, when someone's with patients with lipedema, I mean, they're mostly healthy. I mean, very rarely do they have medical problems, and that's one of the baffling things about lipedema is you can be, obese, your BMI can be high, and you can have, a lot of fat on your legs, but most patients don't have high blood pressure or diabetes or anything like that, and it makes doing awake procedures a lot safer versus if you were, working on someone that had heart disease or they had strokes or they were a big smoker, then, you obviously can't do it here, and it would be better to do it at the hospital. But yeah, for most patients with lipedema, they're very healthy, so it's a really good option.
It's a safe option if you're really to the point where you've done everything else, then this is what this is the last straw, and it's the thing you're going to do. Then, make it as easy on yourself as you can. I've had some major surgeries in my life. I've had orthopedic surgeries from sports injuries, things like that. And honestly, I have felt that getting, shaking off anesthesia is harder than recovering from surgery in a lot of ways. So you eliminate the part that's really difficult to recover from. And you're back up and moving and doing all your normal things. I mean, really inside of a few weeks. I could have, honestly, you asked me not to go 100% for 6 weeks. That's what you said. And I felt like I could have, like, 1 week after.
Yeah.
So, and I didn't. I listened and I did what you asked me to do. But that's the thing. It's like, just take that day and time and get it out of just stop worrying about it and do it, and then it's over. So it's like,
Right.
it's worth it. It really is.
Right. Well, this has been really, really helpful. I think your story is it's very unique in some ways, but you also have a lot of similar characteristics with the patient that doesn't know they have lipedema and they're trying to, like, fumble through and figure it out because they just want to feel better and feel normal again. I really appreciate you sharing your story and taking the time out of your day to sit down and do this, and then obviously for letting us use it so we can help share the story and get some good information out there. Anything that you feel like you want to add, or any other questions that you have for me before we hop off here?
No, just thank you. That's all I'll ever tell you. I tend to be kind of a private person. I don't really talk about things. I just don't. But I think it's not just for patients that need to get help with lipedema, but just the fact that you are honestly the best doctor I have ever been to in my life for anything. Hands down, the best plastic surgeon I've ever worked with. And I say that personally and professionally. So, I have, you can put me on the record as saying there is nothing in it for me to say that at all. Yeah. It's the truth. And I think that's honestly, at the end of the day, the most important thing is that you are doing a really amazing thing for people that need help, can't often get it. And not only that, but getting really good medical care too. And that's a big deal.
Yeah,
so
I appreciate you saying it. It's really kind of you.
I mean it. I truly mean that.
Well, thank you so much again for everything today. And thanks for your time.
100%. You're welcome. Always.
All right.
All right.
Bye.